Afternoon, everybody. My name is Mike Klassen, and I'm the Vice President of Public Affairs at the BC Care Providers Association. Before we begin, and I know some of you are just sort of coming on the line now, I'd like to acknowledge that we're hosting this meeting here in Metro Vancouver on the traditional lands of the Musqueam, Squamish, and Tsleil-Waututh people, and extend our appreciation for the opportunity to hold this dialogue based here today. In attendance today, we have providers of seniors care and independent living services, members of the public, and representatives of seniors advocacy groups, as well as our partners in the labor unions. I'd like to welcome each of you to this important discussion about the support services which long-term care and assisted living staff can draw upon to support family caregivers through grief and loss. While the focus of the discussion will be on ensuring that long-term care and assisted living operators know what resources are available to support them to assist families, I'm confident that everyone in attendance today will come away with valuable learnings. Questions for today's panelists have been prepared in advance. However, should there be available time, we'll try to answer attendee questions, so please submit them using the Q&A option at the bottom of your screen. We will begin today's forum with a short presentation from each panelist. We will then move on to a panelist discussion. A resource list will be made available following today's session, and as well, it's our intention to make sure that the entire presentation for those who are unable to attend today during the live session will be available on our YouTube channel, which is linked on our home care page at bccare.ca. BC Care Providers Association has been advocating to reunite residents with their families for many months. In fact, it was at the middle of June of 2020 when we sent a letter to Dr. Henry and Minister Dix asking them to lift the restrictions. About 10 days later, in what appeared to be a bit of a hastily put together news conference, Dr. Henry and Minister Dix responded to our request by allowing a single designated visitor and creating funding to allow greeters that would make it more easy for care home operators. So fast forward over the several months after that, and our organization, largely through the voice of our CEO, Terry Lake, spent a lot of time speaking to the public through media and other channels to really try and elevate the importance of these vital family connections with residents and family caregivers. So you'll know that on March 25th, just recently, Minister Dix and Dr. Henry announced that visitation restrictions would be finally relaxed. And while this news is nothing but positive for residents and the people that care and love for them, there are many things to consider as our members look forward to welcoming family caregivers back into the long-term care and assisted living homes. And we also know that as of yesterday, new restrictions are being placed upon the entire province. So it comes at a time of some peril. I think that we have to be very concerned, and we have to be very mindful that there are going to be risks involved in this. So we're going to continue to appeal using our usual channels to the public to take time and have patience as we try and reunite families with residents in care. Preparing to support family members, many of whom will experience feelings of grief and loss triggered by the physical and cognitive changes they noticed after being apart from their family members for such a long period of time, is a proactive step that the sector can take to ease the burden on our care partners. So without further delay, I'd like to introduce our panelists. I'll start with Kim Slater. Kim is the chairperson of the Vancouver Island Association of Family Councils. Formerly established in 2010, Vancouver Island Association of Family Councils represents member councils from resident care homes throughout Island Health Authority. The group of committed volunteers advocates for enhanced care and quality of life for all residents in Vancouver Island long-term care homes, and supports and encourages the continuing involvement of families, friends, and advocates in all aspects of long-term care. Welcome, Kim, and thank you for the important work that you do. Sarah Eveneshen is the Provincial Coordinator of Program Development at Alzheimer Society of BC. Sarah brings over 10 years of experience engaging seniors in support programs and initiatives designed to improve quality of life, particularly among those living with dementia. Sarah holds a BA in health science and an MA in gerontology from the Simon Fraser University. And thank you for joining us today, Sarah. Finally, Barb McLean is the longtime executive director of the Family Caregivers of BC. Barb has over 30 years experience in nonprofit, government, and private sectors, a BA from the University of British Columbia, and a Master of Arts in Leadership and Training from Royal Roads University, and sits on too many national, provincial, and regional committees to list. Barb is also knows firsthand what it's like to juggle work, a young family, and caregiving. She supported her family during her own mother's fight with cancer. So now we have a chance to hear from our panelists, and I'd like to invite them, beginning with Kim Slater, to deliver their presentations. Over to you, Kim.
Well, hello again. I'll begin maybe with a little background about us to add some context to my comments. We've grown into a collection of councils from throughout Island Health. And we have council members in probably 12 or 13 different municipalities within the island. And largely our goal is to share with each other information, observations, experiences, and ideas in order to position ourselves to take suggestions to the health authority or to the Ministry of Health. And many of those suggestions are related to policy. We're currently the only association of our kind in BC, but we've also been contacted over the last number of years by many councils from the mainland. And so now they are a kind of affiliate members of our association. And they too are interested in having regional associations of their own because they know the value that they bring for residents. And I'm going to give you a quick example of how we work because it's very much related to the topic of discussion today. I think it was way back in August of 2020, we were very grateful to receive an invitation from your organization to contribute to the best possible visit guidelines being created by your team. Why were we so grateful? Well, number one, because we were asked. And number two, because we knew that we could contribute to the value and the effectiveness of the document because we, like you, have a very vested interest in its success. And we also have a vantage point that might be a little bit different than yours, and there's a value to that. So I shared details of the project with our membership, asked for their ideas, and received many, many responses, in fact, from all over the province. And we synthesized them into, I think, about 7 or 8 different suggestions for revisions or additions in the guide. And we were so happy to see some changes made in the document because of our input. We saw that our recommendations mattered. We now had a sense of ownership in the success of it. And being heard and being involved helped to ease at least some of the fear and the pain that families were already feeling because they felt at least their ideas were contributing to hopefully a better future for their loved ones. So I strongly suggest that you consider that when you're meeting with families again. Have them know that they will be included in planning to improve things in whatever way you can, within resources available, moving forward together with and eventually without the pandemic. You're right that residents and their families have suffered a lot, and we've gotten many emails sent to us over this period of time from all across BC. And I think in preparation for what you're about to do, there's a value in me painting a picture for you, just with a few parts of some notes that we got. This one, for example, from somebody who had been helping a mother for a long time, every single day, and this was prior to the pandemic. So concerned about mom now because knowing that the staff could not likely do the same, knowing that they'd be stretched so thin. Some comments from it. I was mom's bath person. I also did nails, feeding, and medications, plus translate for her. I wasn't allowed in. Her hair wasn't washed in over 2 months. The funeral director noticed. Mom died alone. Another one from somebody very concerned about a friend who had a husband in care. Some comments. Her husband is on the first floor so she can see him at the window of his room. He was in trouble, but they wouldn't let her in. But she could be of such great help if they would just let her in under essential visits. That man also died a few weeks later. This one came just a few days ago, actually after I shared information about the possible reopening. It says, "Hi Kim, thanks for the info. Sadly, my dear mother didn't make it out alive to get beyond the lockdown. She was 2.5 months short." Another brief one, brief but clear. "I am so bitter and angry." Another one, "They are not letting us know anything. I have no idea how my father's doing other than he's still alive. And why are some places letting family members in and others are not?" Now, why would he ask that question? Because those same people also hear stories from our membership like this one. "I have to report that his end-of-life care was exemplary. I was designated as an essential caregiver as early as September 2020. As such, I could visit daily for weeks, for an hour in his room in a small dining area separate from other residents, fully protected in PPE. And this was managed very competently." So I guess what I'm saying is that know that experiences have been shared, of course, and that those experiences are obviously quite varied. They will have questions for you. So my advice is be patient, listen, and provide and explain your answers, and that will help them enormously. The other thing you should understand about some of the folks that you'll be meeting with is that, particularly from our large network, is that they have been actually trying to help you, help them and their loved ones. And I'll give you a really important example, I think. Our association learned about the Equip Care program that was launched, I think, as a joint project between you folks and the ministry early last year. Unfortunately, we learned about it after it had concluded. And we were very appreciative of the targeted funding that was provided. It seemed like for infection prevention and control. But we immediately sent Minister Dix a note. And remember, this is last spring, almost a year ago. We began by expressing our appreciation for the program. But we added that we sure wish he had consulted with us, the very people who actually have someone in long-term care. And we pointed out two basic things. that if he had asked us, we would have told him that, look, many family members are also essential caregivers. And for a long time, they'd been helping to feed, to exercise, and so on for their loved one in care. And that residents needed them to continue in that role. And again, most knew that the tremendous challenges faced by staff and that they would be very thin. Second thing we pointed out was, of course, the growing cost to residents from isolation and loneliness. I mean, those stories have been broadly known all across BC. And what we did was we asked for additional funding for you to help you correct those things, to help you do the things we know you wanted to do in trying to provide quality of life for your residents. But we didn't even hear back from them. And that has added to the bitterness that you heard in some of those letters that many families feel. And to be clear, as an organization, we are very much aware of the difficulty and the complexity of the situation. And we also know that each site and each situation has its own particular challenges. But with financial support from the ministry, and if they had then also promoted some accompanying dialogue between you folks and your families, at least some options might have been explored that weren't. And some situations would have been improved. And families would have been part of that problem solving and gain some comfort from knowing that. And I'm sharing that you partly to let you know that families have always wanted to contribute collective ideas toward the provision of best possible care within resources available. And knowing that might help you to frame and have successful conversations with some of your families and help you with your plans to move forward together. When you meet with family members, of course, you'll be meeting mostly with those whose loved ones have survived, but they know all the stories and they will need the kinds of support systems that you can provide. And Barb from Family Caregivers will be providing you with resources to help with that. So I'm going to focus still in a different direction as I begin to wrap up here. Beginning by saying that there are lessons to be learned with this pandemic, and acknowledging and responding to that truth with your families is one of the best ways that you can help them move forward. But the main lesson is, in our opinion, one that might surprise you. I think the single thing that has devastated families so much is that the vast majority of them feel like they had absolutely zero input into any of the policies that were designed by the Ministry of Health to meet the, admittedly very challenging situation. But the thing is, those families had important collective information and ideas to share with the Ministry of Health that would have helped with their planning, but it didn't happen. Family members were not invited to share their experiences or their ideas. And the thing is, it hasn't happened during the pandemic, but it has also never happened prior to the pandemic in a robust, structured way. And here's the thing. They know that that kind of input is being sought from every single other stakeholder in long-term care, but not from them rather. And you can help that to change, and that would help your family members enormously in their efforts to move forward. How to do that? Get your association to publicly recommend that the Ministry of Health establish a provincial association for family councils. For families, that would finally be a collective structured voice for families who are sending loved ones into care. It would be finally a voice for families that can contribute to policy decisions being made by the Ministry of Health in long-term care. And it would finally be a voice that has the ear of the Minister of Health. And it would be coming from the very people sending loved ones into care. And it would be for the very people for whom policy is designed to help. And families don't want to they don't want to make policy, but they do want to be able to contribute ideas toward the creation of policy. And in my opinion, there could not be a more effective, more supportive, more forward-thinking, and more curative message sent to residents and their families. And that endorsement would instantly resonate with families all across BC. Thank you for listening.
Kim, thanks very much. A really interesting, I think, account of what we've gone through since the declaration of the global pandemic. And you're absolutely right on the point that if we did this all over again, it would have to really be done differently. And so I look forward to the broader discussion with everybody else. I now am going to turn over the floor to Sarah from the Alzheimer Society. Sarah. And again, we'll have to get our moderator, our host, to be able to unmute and mute people, please.
Perfect. Can everybody hear me okay? I see that my microphone's back. Wonderful. Thank you. Thanks for unmuting me. And thank you, Mike, for the introduction. Again, I'm Sarah Eveneshen, Provincial Coordinator of Program Development at the Alzheimer Society of BC. Being in program development means that this has been a heck of a year, trying to change our whole programs and how we support families. So I'll talk a little bit about who we are at the Alzheimer's Society of BC, and then I'll talk about our programs and what it is that we've seen this past year in the families that we're supporting, which is very similar to what Kim just described. It's been a challenging year for everybody, as we all know. The Alzheimer's Society of BC, we're a provincial organization. We're celebrating our 40th year this year. We're committed to supporting families affected by dementia all across the province. So we have different offices in different communities. I think we are up to about 20 offices. Of course, right now with the pandemic, we're all working from home, but we have a provincial office where we have adapted our programs and we're delivering them that way. Right now. So what our programs essentially look like is we provide education and support for families and also healthcare providers affected by dementia. We work on advocacy initiatives for families with dementia and affected by dementia, and we provide support for valuable research into dementia as well. And not just what's going on in the brain, but the quality of life that is so impacted by dementia. So to Kim's point, what we have observed in the last month through our programs and supporting families is definitely a lot of grief. There's been a lot of change. People who have been very involved in their family members' care have been left out of that. It's been a huge change in their role that we've seen. On our staff side of things, when we talk to family members, the calls are heavier. And increasingly so as the pandemic goes on. The emotions are stronger. There's definitely that sense of frustration coming through from people. And we even see this, in our webinar chat box, for example, it'll surface in all areas. And I think Kim spoke to this quite eloquently. where essentially people just want to feel heard. Family members aren't feeling heard right now. And this is what we're hearing most strongly. They're seeing a decline in their family members as a result of the isolation and the decrease in that meaningful social contact. So not just at a distance with a mask, but actually being able to touch the person they're visiting if they can get that essential visitor status. And I think this is something that families are most looking forward to with the changes in the visitation restrictions coming up, is finally having that chance to be in the person's room, to hold their hand and really have that meaningful human connection that has been so missing. Recognizing that even with mask, for someone with dementia, it can be very much a challenge. Just that connection goes a long way. One of the things we have heard quite strongly with families is that how visitation looks has been quite different all across the province, as Kim had mentioned, that some care homes are a little bit more lenient with what they allow, and other homes are a little bit tighter with their restrictions. So when family members come to our support groups, there's that sharing of who gets what, essentially. And sometimes this can stir up some grief for people, knowing that, you know, if you live in one community, you might get to see someone more often than in other communities. So we've really been focusing on addressing the feelings behind this, and really providing that lens from the healthcare provider side of things as well, that this is also hard for the care staff. Certainly it's not easy, like Kim had mentioned again. We know family members are more than visitors. They provide essential care services that really go a long way to supporting someone with dementia in care. And their role as a caregiver doesn't change when the person moves into care. We know this. And so this is something that's come out quite strongly. I won't speak too much on this because again, I think that Kim really hit the nail on the head with a lot of his points. So I'll talk about what programs and supports we provide as a society, knowing that about half of the families who live, or half of the people living in care, have a diagnosis of dementia. We have programs that are specific to living with dementia. So I want to say our first one is the First Link Dementia Helpline. So anytime we have a webinar, we'll talk about our First Link Dementia Helpline. And that's accessible for healthcare providers, family members, anybody to call Monday to Friday, 9 to 8 for the English line. We also have Mandarin and Cantonese services available, and Punjabi as well. And so you can call with a question if you're a healthcare provider and you're not sure how to respond to a behavior that you're experiencing with a patient, then you can call us. We can talk through it with you. And if you're a family member, if you have a question, if you don't know what resources are out there, how to get into long-term care, or just are feeling the grief and need someone to talk to who understands, then we always encourage to call the First Link Dementia Helpline, and we can talk through that with you. Normally, pre-COVID, our education looks like in-person workshops all across the province. Of course, with COVID, we've shifted to a weekly webinar, and the topics change all the time. And sometimes we have guest speakers. We've had the Family Caregivers of BC as a guest speaker last year as well. And we have had, we're trying to be responsive to what we're hearing people need. So for example, at the beginning of the pandemic, we did a webinar on caregiving during COVID and what this might look like for you, of recognizing that every experience is very unique. We also did a webinar on virtual visits and making the most of video calling with someone with dementia. So we try our best to take the pulse of what we're hearing when we're talking with families and provide responsive education that responds to what is going on for them. Of course, post-pandemic, we will resume to those in-person programs again and just run our virtual programs parallel alongside those. If someone misses a webinar, then we have them recorded. They're available on our website so people can watch them whenever it works for them. We have support groups for caregivers right now, and in about a month, we'll have support groups for people living in the early stage of dementia. Our support groups are available either regionally, so people connect with others in their community, which for families in long-term care, they might want to hear from the experiences of those in their particular community. But we also have about 4 support groups for caregivers of somebody living in long-term care. And we have found that This group has been the most in demand. So we started with one group and we kept having to increase the number of groups specialized for families in care because their needs were so strong in this area. And certainly these are the groups that really require the most support, I think. So they're quite heavy, of course. That being said, with the changes and restrictions coming up, we are hearing hope and excitement from family members. There's some anxiety over what they might see if they haven't been an essential visitor and haven't been able to see their family member in some time, but there's certainly that hope and that gratitude that they'll be able to have more time with their family members. And we hear appreciation for the work that care staff have done in trying to really bridge that connection with family members. So even if iPads aren't the best thing, for some people, it's a way for family members to see the person living in care, and staff have gone a long way on whenever they can supporting those connections. So certainly I'd be remiss if I didn't say how much appreciation we've heard for the care staff from family members. We have resources for healthcare providers as well. We have education for healthcare providers, webinars like this. So certainly healthcare providers can reach out at any time. We have resources you can provide to families in care. So one thing that you'll be provided with, I believe, at the end of this webinar is a sheet of resources. And one of those in particular is a list of resources that you can provide to families, whether that be something you print out and put on the wall or how to refer them to First Link. And I'll just talk briefly about First Link. Oh, I see I have about 5 more minutes here. So First Link is our way of connecting people to dementia support. And really what that means is healthcare providers, any healthcare provider, any care staff member can complete a formal referral. It's one form, and you can send that to us and we'll reach out and contact the families directly to support them. And while it is something that you can say, call the Alzheimer Society, we know that when caregivers are stressed and you're grieving and you're tired, something as simple as making a phone call can almost seem insurmountable. It's one more thing on their list to do. So with First Link, you can put the referral in for them and we'll call them and we'll make sure that they're doing okay. We'll send them the resources. They don't need to worry about it. We'll provide the support to them and then we'll check in with them regularly. So at the beginning, we'll call them every few months to see how things are going, answer the questions they might not know that they had. And then after this time, we move to every 6 months or so, unless they need support more frequently. And this can be at any point in the dementia journey, even if their family members in care and they've never heard of the Alzheimer Society of BC before that, you're certainly welcome to refer them to us at any time. And I do have more information on that in the resources that you'll be provided. You can send it in by mail, email, pigeon, however it works for you. We have an emergency medical record service. So however it works for you to send that in, we're happy to receive it and connect with that family member. Yeah, so I think that's our society in a nutshell. Certainly, I hope that we have some questions at the end so I can hear from some of you. And at any time, if anyone has any questions, we go back and always say, call the First Link Dementia Helpline. That's a great first place to start. That phone number will be in the list of resources.
Terrific, Sarah. Thanks very much. We'll have some great questions to ask afterwards and allow you to expand upon some of the things that you've just presented now. But now we'll turn it over to Barb McLean. Barb, you have the floor and with your presentation. Thanks.
Thank you, Mike. Hi, everybody. Great to be here. I just want to acknowledge the BC Care providers. It's times like these where we all need to work together and come together. And so we have the opportunity to share perspectives and learn things together, because depending on where you stand, everybody sees things a little bit differently. So it's been incredibly helpful over the last year to be in connection with all of you, so that we're more informed in sharing back to family caregivers of, well, how is it, what's the experience of being in the workforce and providing care in a long-term care facility? So thinking about human beings during this time of COVID has really been helpful, and that we're not all experiencing the same things. with Family Caregivers of BC, we're celebrating, this is year number 32 for us. And so for 10 years, we've been a provincial organization. And before that, we were only based in Victoria as one of the first organizations of its kind supporting just caregivers in general. And so that is what we do. We're generalists. It's all about the family and friend caregiver. And increasingly, it isn't just family, it's your neighbor, and it's maybe your best friend. And increasingly, so a family caregiver really is whoever the person says it is. So that's our expanded world today. And I think our systems really need to catch up with that and invite your circle of care into the world of a patient. So we're seeing that. Now, at a glance, Family Caregivers of BC has 3 basic pillars. And the first one is about directly supporting caregivers. And that's through our caregiver support line across the province. And that's 1-877-520-3267. And that all the things we talk about will be available on the website and in the resource package that will go out after this. We offer one-to-one support with non-judgmental, empathic, skilled people on our caregiver support line. And if caregivers are finding things to be a little bit tricky, you're stuck, you're not sure where to go in systems that are tricky, we have a caregiver coaching program that you could be referred to if that makes sense. We also have a number of different kinds of support groups and models around group support. So right now we responded to COVID with just pivoting. And of course, just like Sarah was saying, we had to create new things that didn't exist before. And the virtual model of support has been working really well. And so for anyone, anywhere, all you need is a telephone. You don't even need a computer, and you can participate in getting support. So every single corner of the world basically has been tapping into some virtual resources. The other thing that we focus on, so in addition to that, in direct support, is about education. And we know that the world and the future changes as we learn new skills. And we divide that into education for caregivers and education for healthcare providers. And please visit our Learning Center online, and we have a number of resources from modules to flip books to our new podcast series, which is in our 2nd season. And we're finding that very busy people are listening more. So they're tuning into that podcast idea. And so that's another thing we've been doing to pivot is, well, how do people consume information? Well, they just want a break, put on their headphones, sit back with their coffee and listen. What we're also seeing is an increase in interest across the healthcare provider range of healthcare provider education. And so one example of that is we partnered with Safe Care BC to adapt the social visitation essentials so that caregivers are getting those skills and knowledge around infection prevention and control. And that's a great partnering with long-term care and assisted living settings. Go and learn those skills, and it's one less thing that you need to worry about in terms of spread. The third pillar in our organization is all about changing the future, and that's our health system collaboration pillar, as we call it. Our ultimate vision is that family and friend caregivers are considered and included as partners in care. Right now, the good news is that's happening in some cases, and the bad news is that we have a long way to go. And in long-term care, that's been an experiment, the pandemic experiment that's really shown how those voices haven't been present. Much to what you were saying, Kim, it would be a good move to have those voices at decision-making tables before those decisions are made. So that is where we come in as partners in care. We're part of Patients as Partners. It's an initiative through the Ministry of Health, and it really is about including the voices of family caregivers in health system improvements. And so we recruit caregivers, and we also, part of our team, we sit on committees, we're part of forums and dialogues, and yet we weren't really part of the conversation around pandemic response. So it illustrated this huge gap, and we're all working together to create this change. You know, part of problem solving is the people who are impacted need to be at the table. And family and friend caregivers have been impacted in a big way. So outside of long-term care, about home care and the reduction, you know, 80% of the care is provided by family and friends. And that's something we need to desperately pay attention to. So within that pillar, we're looking at identifying caregivers systemically, referring them for support, because there's a lot of support that many people have no clue that exists. And number 3, to include them as partners in care. And again, looking at our pandemic response into long-term care assisted living, we noticed when the caregiver was not there, didn't we? We saw the impact and the decline of a person's health without a family or friend caregiver being there to do what they normally do. We conducted a survey, and that was in the field in December. It was province-wide, and some of the high-level results of that survey that we've analyzed is that what was hard got harder for caregivers. And that's probably not a surprise for any of us that are thinking about it. But 55% of family caregivers said their mental health has been suffering, and that 40% or over about 44% said their physical health has been impacted. And so if there are a group of people in our province that are providing 80% of the care, we need to make sure that we're finding those caregivers and that we're putting the support where it needs to be. Another theme was about the financial hardship, that for people that were living already very close to the edge of their means, that the pandemic has really impacted their well-being financially. So put it all together, the scenario is that family and friend caregivers aren't doing so well. The COVID pandemic created new caregivers, but maybe some of the good news there is that some of the younger, fresher feet on the ground for caregiving are used to accessing resources online, and they're actually doing better. We also know that we've conducted a couple of forums. One's a town hall and one was a forum with partners across Canada. And some people were actually saying, I felt relief. So my mom, for example, went into long-term care. And for the first time in many years, I felt like I had a break. Someone else was doing the caring and I wasn't allowed to go. So I actually had a moment to breathe and recollect. But those quickly, the feelings, if we're to look at some of the stories we're following, the feelings of relief for many people turned into guilt about those feelings, and I should be there, I should, and then anger and resentment. And looking at, give you one example, much like you were talking about, Kim, the stories of caregivers. For some, they're describing attention. So visiting the person they love or care for in long-term care, there was a tension between feeling the gratitude. So one example is a woman who visited the screens in front. Her mom comes in and they sit down. Her mom has dementia. And so the ability to touch is her real communication strength. And they haven't been able to do that. So in their conversations, you couldn't use the haptic where you reach in and you touch to get a connection. And her mom was just off. There was no real feeling of even the value in the visit. So they would sit for a few minutes until her mom said, I'm done. She would turn and hug the employee behind the screen. So this caregiver would get up and leave. And those are the kinds of visits that they have. And she was saying, I feel such gratitude that my mom gets to hug someone. It doesn't matter who. I wish it was me. And then I have great sadness because it's for a good reason. We're trying to keep everybody safe. That's a different story between someone who said, I, like Kim's story, for the last time saw my dad through a screen. I couldn't touch him, I couldn't hold him, and I couldn't hug him, and I never saw him again. That would be the time when there isn't real gratitude. There isn't a feeling of acceptance that it's for a good reason. It made no sense to that group of people that have lost somebody and didn't get to touch, to hug, and be there. So far too many, we see the implementation of essential visits being radically and disproportionately unevenly implemented from facility to facility. So that would be one theme, is let's get consistency in how things are implemented when things are being decided. So Kim, you spoke a lot to your stories. That resonated for me. Your stories very much some of the stories we've heard through our caregiver support line, our support groups, from tremendous gratitude and at the same time, tremendous grief, loss, guilt, anger, and frustration. And so part of our story today together is to prepare for reunification, prepare for more people to be seeing the person they love in long-term care once again or more frequently. And I think we do need to be ready for that. finally, I'm at 12:47. I think about the moments of opportunity that this pandemic gives us, and the way that family and friends need to be considered as partners in the entire circle of care, and that we will do better together than apart. And for us to be able to consider the logistics and the guidelines and how it is that we could work together as partners instead of us and them. And so my final observation about what we've been hearing is a real focus by the average caregiver is viewing the system as them, and it's those people. It's not us, it's not we. No sense of feeling connected and together on any kind of decision making. And I think both Sarah and I are going to speak to that later, is where does anger come from, and what do people do with their anger, and how do we diffuse it in situations where we are fearful that it might go sideways. So if I were sitting in the shoes of being a frontline care provider, a decision maker, or somebody who is the first to welcome, I'd really think deeply about just being superhuman and really being connected to the welcoming of people back into a facility that we know has been fraught with ups and downs and a lot of torment and a lot of feeling, and to just know that it comes with the package for some people, but not all people. Some people are saying, I've done quite well, I'm ready to get on with it, I'm hopeful. And so the story isn't all bleak, but we have a lot of change to see happen. And my hope for the future is that we use our lessons learned in the pandemic to work even more closely together, to solve problems together, and that the voices of family and friends are included as we design what's next, because we know from the science of pandemics that it's not going away. So we can work smarter because none of us can work any harder. So I'll wrap it up there. And probably the most important exit point on describing the services of family caregivers is knowing that you don't stop being a caregiver the moment somebody goes into assisted living or long-term care, that role continues. And so there is still such a need to offer resources such as the Alzheimer Society, family councils, and family caregivers of BC to all families that are part of the long-term care assisted living family. Thank you, Mike.
Thank you, Barb, and thank you, Sarah, and thank you, Kim, for those presentations. Before I go on to some of our Q&A session, I'm just going to make one comment and observation. I think two of the best days I've had in my career here at BC Care Providers are been the days that we've been able to allow ways to get families and family caregivers to have closer access to people in care. I'm thinking of what happened at the end of June last year and what just happened a week or so ago when the announcement came from Dr. Henry. And so we've been reflecting a lot about the kinds of decision-making loops that have happened and where things have broken down. And one of the things that we would very much like to see, I think, after this, as a learning from what we've experienced the last year, is finding ways to make sure that every important voice is at the table, because we do feel that sometimes there are decisions that are being made that we're not being included in those discussions. And that's something that I think we can all work together on to make sure that we can find more ways to have representatives of care, representatives of family councils, representatives of labor unions, and others that can be in the same room, and the health authorities, so we can all know what the priorities are. So I just want to remind all of our attendees that we're going to be making a great resource list available to all registrants following the session. And for those who came in late or would like to share some of the information you've been hearing here today so far, we will have this presentation posted on our YouTube channel after this program is over. So now I'd like to start by giving some questions to the panel. So I'm going to get our host to make sure that all of our panelists are unmuted, and I'm going to make sure that we start right off with a question I'll go to Kim, and then maybe Barb, you can sort of follow this up. So looking back in the last year, what recommendations would you have moving forward in a way that we can, that meaningfully acknowledges the learnings we've made through the pandemic? Kim?
From my point of view, it's what I summarized with, I guess, having a mechanism in place so that you don't hear from families and family councils in particular in a passive way, that you hear from them in a structured, proactive way. And I'm talking largely about the Ministry of Health, because the Ministry of Health is ultimately responsible for building policy that's going to affect every single resident in care across the province. Have that system in place. It's long overdue. Other jurisdictions do it. BC has not yet, and it's time to make that happen.
Barb?
The number one thing that families told us was communication. Communication was dismal. I can't think of it horrifyingly dismal for some and incredibly good for a small group of people. And we tried to say, why is that? From a systems perspective, whatever happens moving forward, this disparity between really good to absolutely horrendous, that has got to change, because we're going to need ongoing communication for all reasons, not just pandemic related. So if we're to structurally and systematically create a better system of communication that operators were required, and I mean required to do. Right now, it's left up to the individual operator. Yeah, we're going to do it. Maybe we won't. And there is no consequences for not following guidelines or recommendations. And so this seems to be the problem. There is no standard. And our seniors advocate, of course, looking at Isabel Mackenzie's recommendation on this is something that I believe we need to take seriously. That would be one excellent concrete step. That really, that's our top theme, is the abysmal communication. Let's fix it and get on with it, because that's not the most tricky element to change in our system, as I understand it.
You know, I thank you for both for your observations on the subject of communication. As somebody who is responsible for spearheading the communication for our organization, I know that when I speak to our members on a regular basis, one of the things that they struggle with often, depending on the amount of resources and depending on the situation, for example, if the care home is an outbreak, communication does suffer, and it suffers because people are overwhelmed. And if we can provide them with tool sets that would allow them to more easily to be able to speak to the stakeholders in their community, speaking to the family members and loved ones of people that they have in their care, and to their staff. I find that the operators that were most successful at overcoming or even keeping out COVID were the ones that talked to their staff every single day, really stayed very clear on what was happening. And so there's no guessing going on. And because sometimes people like to fill in the blanks for themselves. So I think that's a really great lesson for us to put near the top of the list going forward. So I'm going to ask a question. I'll start with Sarah, and then maybe Barb, you can follow up as well again. So what is the one thing you wish people knew about caregiving and grief and loss?
Yeah, thank you, Mike. I think the number one thing, and um, I mean, it comes up all the time, but really that grief and loss manifests in so many other ways that we don't expect or realize, and predominantly anger and frustration. So, you know, a caregiver might seem upset, for example, that their mom's hair isn't getting brushed. But this might not be that they're so angry that the hair's not getting brushed. It could really be that they're grieving that their mom can no longer do this for herself, or they're grieving that she's in a position where they can't provide this for her. Um, I think for anyone who works with people with cognitive impairment, we know that behavior has meaning. So when someone gets upset about something that seems minimal, there's something more to that. And I think as care providers, you know, I recognize it's hard. You have so many demands on your time, but really trying to understand why that person is getting upset about something that seems like it's not so big, it's most likely that they're dealing with that ambiguous loss that comes with dementia, that relentless series of losses that comes with dementia. And with that, this profound grief that really doesn't end. It just sort of surges at different points along the journey. And it can be amplified by things like the COVID pandemic, the restrictions on care. And we've been hearing from some caregivers, especially with the restrictions in place, that some people have kind of set that aside. And it's very well that when they see their family member again, it might open the floodgates for people. So just being prepared that that grief might come out. They might seem angry or frustrated, but finding the time or the space, if you have a space in your residence where you can sit down and really get to the heart of where that's coming from. Is it actually about their mom's hair, or is it about something else? And then again, of course, connecting them with us, letting them know that we'll talk to them through that, and we can help them find the source of that grief and that anger and the loss and all those feelings that are coming out for them. And this can really help them communicate in a more effective way as well, which will be a more beneficial relationship for both family members and care providers.
Thanks very much, Sarah. So Barb, what do you wish people knew about caregiving and grief and loss?
Well said, Sarah. So I'm thinking how to build on your excellent points. Maybe to reinforce that caregivers, I always put myself in someone else's shoes. So imagine I'm working in a care facility, and a caregiver is, they're crying or they're angry and they're blasting at me. And I would say, okay, Barb, don't take it personally, because you are not the object of their anger. And because of maybe, if I could give a wish to caregivers themselves, it would be to find support and really deal with your continued losses of caregiving, and don't let it build up to a point where you just lose it when you have a trigger, like walking in to see your mom or your dad. And that shared grief is often best processed. And so that is why one of the reasons we all run support groups. It's one of the reasons we have one-to-one support. It's a safe place to let it all out in the company of people who get what you're going through. And that unless it's dealt with, that is the place where it turns into anger. And so don't take it personally, and have some strategies or responses in your toolbox. If you're a care provider and you think, well, what do I do here? Understanding how to diffuse, how it is that you cannot take it personally, and put it over here and say, I actually acknowledge and understand that you're feeling angry. Let's talk about this, and hand them a Kleenex and just try and help them through the moment. Because if you take it personally, it will escalate generally, and if you empathize and acknowledge, it'll decrease. So I think I would be prepared here and about that. The grief and loss may show up as anger, and that don't take it personally.
Okay. I know that, having spoken to some of our leadership in the sector during difficult times, I appreciate what you're saying, but I also, at the same time, they are during the most stressful time of either during an outbreak or trying to stop an outbreak, or try to deal with all the sadness that kind of comes from seeing people separated. Emotions are pretty raw, and so it's understandable. So I think you're right. We need to find some way to, I don't know if tools is the right word, but we need to have some ways for people to be able to understand and take a step back and take a breath and realize that this emotional reaction is not necessarily aimed at them. Kim, I'm going to ask you, what kind of recommendations do you have for operators looking to build the strongest relationship possible with their family council during this difficult time? And I'll just also add that some care homes have extraordinarily healthy and strong relationships with their family councils. Others, there's more tension there. So for those that might need more work on that, what kind of recommendations do you have for operators?
I think the same kind of recommendations that we have for family members, within our council. Listen well, and learn some things that maybe you don't understand. Exercise some skills when you're navigating situations that have a lot of emotion attached to them. And, you know, one of the things that we say to our new councils that sort of join us is that, look, one of your first and foremost responsibilities is to build relationships with staff and with management and so on, in creating sort of a joint effort to search for best possible care and quality of life, and so on. And you know, I can't help but think back to staff. I mean, staff are people too, and it's easy to say, you know, don't take it personally. But I'm sort of wondering if there are any, you know, in-servicing that can help in that regard. You know, I'm looking at, we've got some friends who are you know, parents of young kids, and we're watching them just pulling their hair out with you know, everything that their kids are going through. And we very carefully try to say, well, you know what, this is another way to look at it. This is another thing to consider. And of course, my wife and I are absolutely perfect at that now. You know, I wish we were. But you learn through time, and you can share those, you know, those skill sets that you develop alone. And I think that would help too, not just for, you know, staff, but also for family members, so that the issues become the focus and not the feelings. Does that make any sense?
It does, and I was going to just add a little. We got a question sent to me from our attendees, and it was more about how do we make sure that the family council and the care home operator are working together to develop the agenda for the council. So instead of having just the care home sort of set the course, how can the family council be more influential in terms of what's discussed and what the objectives are?
Well, I'm really glad you asked that, actually, because I can give you pages of research to show that if family councils are in fact self-determining, that's a way better way to go. There's ample research to show, for example, that family members are largely afraid to, let's say if they have a concern, they're afraid to lodge that concern because they leave the facility and all kinds of things float through their heads about, well, what about mom now? What about dad? I've just launched this personal concern. So it's really, really important that care providers, you know, many of the most successful ones have just independent family councils, and the way they work is councils get together and they talk about ideas that they have, experiences that they've shared, and they put together recommendations for change, maybe, you know, or ideas to enhance quality of life. And then what they do is they take it as a council to management, say, look, we've got this idea that we're kicking around. Would you come and meet with us and talk about it? And we explain that that does two things. It gives management teams an opportunity to reflect and to consider and to, you know, look at all the ramifications and come back with informed kind of opinions and advice that they can give, rather than be, you know, in the spur of the moment. And for family councils, what that does is it allows them to have an environment where they can explore those things and everybody can be heard and so on. And that's the more productive way to go that serves the needs of residents. And that's what we're all trying to do, is to find the best way that we can create that quality of life and quality of care for residents. there are some councils that have ideas that they want to promote in a facility, and if they feel like they don't have a chance to explore those ideas because agendas are being set by management, that's not a good scenario. It's not good for residents. The healthier way to go is to allow them an independent opportunity to consult with each other and to formulate these ideas. I hope that answers your question.
Yeah, it does. It does. It becomes more of a real collaboration, and I think it is probably helps to build a better relationship between the council and the leadership in the care home. I'm going to just turn to Sarah quickly. Sarah, I know you gave a pretty good plug for FirstLink in your opening remarks, but maybe you could just tell us why FirstLink is such an important tool.
Yeah, thank you, Mike. So I'll start by reiterating one of the main benefits that I highlighted earlier, which is that we're taking the onus off family members and getting that support. So as healthcare providers, anyone in a care setting, assisted living, long-term care, really can complete that formal referral form, send it to us. Within 1 to 3 weeks, we'll reach out and we'll call them. And with the regular follow-up calls as well, if someone's okay at first, they might not be a few months later. And having to think about, oh, I'm not okay now, I need to call and I need to ask my questions is taking up that space in your head. So by reaching out, we're going ahead and proactively, saying, how are you? Which for a lot of caregivers, they don't have a lot of people asking how they're doing. So this is a chance for us to come out and say, how are you doing, and to address the questions that they might have. If they can't get to a webinar or they can't access education through other means, then we are providing that over the phone to them. So we're just making that support a lot easier to access. And we've heard from many family members when we call, oh, thank goodness you called, I had such a day. And that relief that someone has called to check in on how they are doing, and not the person they're caring for. We do care about what about the issues they're having with the person they're caring for, but the call is about them. And one thing that we found through evaluations of FirstLink in other provinces is that by completing a referral to FirstLink, a lot of people actually access that support about 11 months sooner. So that's 11 months of getting that support, that education, and that understanding of what's going on with the disease, which can help care providers. I'm sure the care providers joining us today know that when families are educated as to what's going on with dementia, their expectations can be more realistic. You can have that more robust relationship with them, and you can have a real conversation about what is happening for your family members. So please don't hesitate. You can refer someone to FirstLink at any point, and we'll connect with them. We'll help them understand what is going on. And if you don't have the time to sit down and have that supportive conversation with them, then hopefully we can be those people who can sit with them and have that conversation and talk through what's going on with them and get them connected. Yeah.
Excellent. Thanks very much, Sarah. And for those who are not familiar with FirstLink, it's going to be a part of resources that we shared a little bit later on after this program. Barb, tell me why someone caring for a person living in long-term care or assisted living might find a virtual support group valuable.
Well, a virtual support group for any reason, or a support group in general, has a couple of principles that are just, that support groups are about walking a mile in shoes with mutual self-help with someone who gets what you're going through, and it could be any topic. And so with caregiving, we experimented actually with, how in stores there's pop-up stores, again, being fluid and responsive because of COVID, we thought, well, maybe we need to try a long-term caregiver support group, because so many people were coming through the caregiver support line and other support groups that were just this whole thing, and we need to talk. So we did a pop-up long-term care caregiver support group and assisted living. We're not leaving that out. And it gave everybody who wanted to come the opportunity to vent and to be listening to other people and to have a shared experience. And that in and of itself helps to get it out, just let it all out, as Ellen says. Come on, let it all out. And it is really therapeutic and it's safe, non-judgmental, and people walking in a mile in your shoes. So for us, we found that it served a purpose, and then it kind of fizzled because people felt a little better. Okay. And then we popped down, and our regular support groups virtually continue on. And there's something else about virtual is if you need to go and leave and do something, like have something on the stove, or you can actually be in your support group and have multiple things going on around you and still be part of that. If you have to get in your car and drive or go to a support group, it's different. The other thing about virtual is if you have a sense of, I don't know if you feel a little bit more enabled to join. I think that's something else our team has talked about. Maybe if you're a little bit shy, you're more likely to join because you can be on the outskirts, but not visibly seen as not participating. And that's a reason why people don't like support groups. They might say, I'm not a support group person. But if that's your only way to connect, I think we saw some first timers who aren't support group people who joined and went, that was actually pretty good. So it's something to try. You don't want to go through life alone. And given the pandemic, so many caregivers were feeling alone, and you can only tell your spouse or the other person on the phone the same story over and again. They're not really going to get it. But people who are walking in your shoes get it. So they've been very effective.
Very much, Barb. So I'll turn this question to Sarah, and then maybe Barb can follow up. You've got an audience here that has a lot of our leaders from the care sector on this line right now. So speaking to them, what can seniors care leaders who are here today do to ensure that the frontline staff are equipped to support people living with grief and loss?
Well, I think the first thing I would say is make sure that your staff feel supported, that they have someone that they can talk to about how their day has gone with families, because if they have been sort of on the front end receiving all that grief and the anger from families, then, at some point it's going to build up. We are humans, and it will have an effect. So I think whether that be having a designated staff person in your residence who you can talk to and debrief with about what's going on and what you're hearing from families. Having a social worker available. If you have a social worker available in your care home, that's great. What we find helpful is just providing education to staff on really how to diffuse or validate the experience for family members. That goes a long way, and our education is open to healthcare providers and care staff as well. One of the things that I want to emphasize is that if someone is angry, if a family member coming in is angry, it's really hard to get them to the point where they can have a rational, logical conversation about something that's going on when they're caught up in that anger. Anger can be very blinding. So you can't see logic, you can't see what a care provider is trying to explain. But if you can validate that, yes, it's incredibly frustrating for you. I can only imagine how difficult. What would you like to happen? How can we get there? And you try to bring them out of that anger, even if it's just getting them to feel that grief and that sadness. We can connect in sadness. So that's where we can provide that support. So whether that be helping your care team sort of learn strategies from getting them from that anger to that sadness, or another feeling or position where they can have that logical conversation about what's going on for their family members, or contacting us. We do workshops as well, webinars for care providers, so we can certainly set something up and provide that education. And just print resources. So if you're tight on time, we have a number of print resources that we can send you if you have questions to help you guide your staff in how to provide that education for families and that support in those conversations.
Thanks, Sarah. Barb, so from your vantage point, how do you think our leadership can support frontline workers?
Well, Sarah covered the key points that come to mind for me. And one of the things I know about the challenges facing every care setting is time. So if you're to carve off, just like Christmas, we know it's coming around that we can predict, we have a responsibility to create and carve out that time so that our teams are ready. And it doesn't have to be fancy. It doesn't have to be a 1 hour. It could be short, small huddles. And I know some facilities have that approach where they do small micro learning. And in that micro learning, I can imagine that everybody could have a little quick cheat sheet in their pocket. They don't have to memorize anything fancy. It doesn't have to be perfect or clinical. It's about what are some things that you can short and sweet say and do. And those things, like Sarah gave some examples, but you know, when you're in the moment, it's very difficult from a training perspective. Those tip sheets, those cheat sheets that you can just calm down and prepare. They're coming in, there's all these appointments throughout the day, that you can be really prepared and not invest a lot of time and energy into it that you don't have. But it's, I would say it's absolutely essential to prepare everybody for this to happen. And the second thing is to try and find the hopefulness and joy at this time, and not expect it all to be negative. And that might help set, I guess, you know, as an individual, to center yourself and say, this is actually meant to be a joyful time. Whatever has happened in the past is the past, and you get to see somebody you care about, and that as a tool to redirect and look for that crack, that sun coming in, and maybe carry that with you into it. So being, you know how if we prepare for the worst or plan for the worst, but expect the best, that mental attitude probably goes a long way.
That's great. Thanks very much, Barb. Just noting that we've got about 7 or 8 minutes left, so I'm going to get everybody to think about that when they're giving in their responses. And we are going to shift, I think, in some of the more emotional part of what we're about to experience and what people are feeling as this reuniting between loved ones and people in care starts to happen in the days and weeks to come. So I'll just start with Kim. What are you expecting to be most difficult for family members who've not been able to visit due to the pandemic?
Undoubtedly, it will be the shock of seeing the change and the grief and the sadness that comes with that. And I think, you know, just like everything else, providing information has been important all the way through. And that's one of the reasons we made that recommendation and the guidelines. Make sure that you're sharing information regularly. But still, when they meet with them, I think if they're said, look, here's a journey that they, you know, your loved one took, and here's what's typical of that kind of journey, and here are some things that we can do to maybe help rebuild together, and then to create that sense of team, and to give family members a sort of an avenue to feel that they're involved in promoting the better well-being of their loved one. So.
Great, thanks, Kim. I'm going to, for this next question, I'll start with Barb and have Sarah round it out, and then I'm going to try and make sure that we have a couple of minutes just to give a couple of plugs for some events coming up in the next few months. Barb, speak a little bit about the connection between grief and loss and anger.
Those are all normal human emotions. We all have them. The caregivers have them, the staff have them, and we've gone through an incredible time. And I think this is one of those times where we have to just acknowledge and let some of those emotions happen. I think for many of us, our first instinct might be, oh, I got to do something, I have to stop it. And it can be upsetting to witness somebody who is crying, somebody who breaks down, or somebody who is showing anger. But in a safe way, letting that just follow its course is something that's okay to do, because those are normal emotions. And when I think about for some people it's puzzling, they might take it personally, it's displaced anger. And again, going back to what we were talking about before, that to recognize that it isn't you can really help you remain calm if you're the object of that anger, and to keep in mind that it's not because of me, it's because of the circumstance, and then to shift your behavior into helping to diffuse the situation. And there are going to be more losses ahead, that this roller coaster, and usually loss and grief response to loss is a roller coaster. Sometimes you think you're fine, and all it might take is Mike, you might say, Barb, how are you doing? And somebody might not have asked me that. It might be, how's your mom doing? You ask me that, and boom, I'm a heap, and I'm a heap, and I didn't mean to be, and you didn't mean to be, and you don't have time for it. Sometimes you just have to say, oh, well, and be empathic and be there, and then I'll collect myself and I'll move it along. But I don't think we can avoid this from happening. I think we need to treat it as a normal experience that's appropriate for our times.
Absolutely. We have been going through a very difficult year, and we can't just shovel it away, pretend that it hasn't been. Sarah, your thoughts on that connection between grief and loss and anger?
Yeah, well, I think Barb said it so beautifully that I don't have much to add on that side of it, but I also want to recognize as healthcare providers, you will also have that grief, loss, and anger that might get stirred up if you're receiving that from family members. So just be aware. I mean, you might not be perfect every time, so there might be instances where you can sort of sit and be present with the person and help diffuse that, and there might be some days where it's too much for you and you respond as well, maybe not how you would have liked, but we're all human. And oftentimes if you come back to that family member later and say, look, I was feeling this too, and it's also hard for us, how can we work on this together? Most people will recognize that human response and they'll level with you. And that's a building block, really an essential relationship, to have a good relationship with those family members. I'll just quickly note in the resources that will be shared after this webinar, we've provided some information for a visitation guide, essentially, to help family members prepare for before the visit, during the visit, so what they might expect when they're seeing their family member again, if after some time, and then after the visit, so if they're feeling those heavy emotions, what they can do. So please see that resource that you can distribute to family members. It can really help them.
Thank you very much, Sarah. So I'm going to ask the last question on the forum. We're going to have a little bit of closing remarks that are around some of the events that are coming up that we'd like to promote. But just, can you give me between sort of 30 to 60 seconds on this answer? And I'm going to ask all three of you, and I'll start with Kim. What should family members keep in mind ahead of their first visit?
That there will be significant changes. It was my own experience. And I think they need to know that staff lament those changes every bit as much as they do. And I think they need to know that let's again build a team so that we can move forward together as best as we can and listen to each other. And they also need to remember that facilities are not responsible for all the policy decisions that were imposed on them, you know, and that's really important.
Thanks very much, Sarah.
Yeah, I mean, you said it wonderfully. I think just, again, that understanding that it's been very hard, and that you know, you might not know exactly how you feel. You might think that you'll feel fine, that you've expected the changes. And as Barb had mentioned, you feel sort of that overwhelming flood of emotion that comes. And that it can be helpful to have someone there to support you, whether that be, you know, plans to have a virtual coffee with a friend after your visit, just putting that support in place before the visit, so that if you do have that flood of emotion, you have that support already available to you for after.
Thanks, Sarah. Barb, what should families?
Ditto.
Yeah.
I was thinking very strongly about having a personal, your own personal support plan. And when you leave the facility, you want to go there and have the very best visit possible under the circumstances, and know that you're likely going to do better the next time and the next time. And that the difference is what you do in between your visits to manage your own emotions is important. So that coffee, that run, the walk, the whatever it is you do to help your own self-regulation, to manage your grief, loss, guilt, anger, all of those things will be really important. And that the sun does come up the next day, and that you have the opportunity the next day to even think more hopefully, and the next day and the next. And so that sense of optimism that it is going to get better.
Well, I want to thank all of you, and I want to thank all of our attendees for participating. We'll have some follow-up. I take some pride in being able to end on time here, so I'm going to give a couple of last words. I'm going to ask, first of all, Sarah, can you tell us about an event that is coming up for Alzheimer's Society of BC at the end of May?
Yeah, on May 30th, we're having our now second virtual Walk for Alzheimer's. It's usually in person, of course, COVID. And so British Columbians can join us at any time throughout May. You can, do a walk and raise that awareness and show your support. So to register, you can go to support.alzheimer.ca, and you'll have more information about a walk in your community and then how you can support us.
Excellent. Thanks very much. And I should note that BC Care Providers and Safe Care BC have our own team. So, Barb, I hear that May is Family Caregivers Month. Can you tell us about that?
It is. This is our third year in a row partnering with other organizations across Canada to really promote family caregivers in their role. And it's Caregiver Aware 2021 coming up for the month of May. Join us for all of probably mostly social media based kinds of events and topics, and let's really increase the awareness. The sad thing is that many people don't think of themselves as caregivers, and so they're not until the crisis occurs. So if we're successful together, people will be able to back it up earlier in their caregiving journey and get some more knowledge and skills and be better prepared so that it doesn't have such a negative impact. That is our hope and that is our goal, and to have a caregiver aware nation.
Excellent. Thanks very much, Barb. So I've got about a minute or so left, and I'm going to give a plug for BC Care Providers. And just to let everybody know that registration is now open for our annual conference. Our virtual conference is going to be taking place from May 31st to June 2nd. Brought to you by our title sponsor, Handicare. The conference theme is the 3 R's: reflection, resilience, and reinvention. And we look forward to you all in joining us at that valuable, great networking session where people can exchange ideas and really look at where we've been and where we should be going. So thank you all again to all of our attendees for coming and joining us. Thank you very much to our panelists, to Kim, to Sarah, and Barb. A really important conversation. Again, we'll be providing resources to all of you afterwards. And for those who haven't been able to watch the whole program, we're going to have it on our YouTube channel. Thanks very much and have a wonderful day.
Thank you.
Bye, everybody.
Bye-bye.